What is a HIPAA Business Associate Agreement, BAA? Have you ever wondered how healthcare organizations protect sensitive patient information when working with outside vendors? Let's talk about the HIPAA Business Associate Agreement, often referred to as BAA. This agreement is a legally binding contract between a HIPAA-covered entity and a business associate. A covered entity usually includes healthcare providers, health plans, or healthcare clearinghouses that handle protected health information. A business associate is an individual or organization that performs certain functions on behalf of the covered entity, which involves using or disclosing protected health information. The main goal of a BAA is to ensure that the business associate will safeguard protected health information in line with HIPAA regulations. This means the agreement specifies how the business associate can use or disclose protected health information. It also requires the business associate to implement technical, administrative, and physical safeguards to protect this information from unauthorized access. Key elements of a BAA include permitted uses and disclosures, which clearly define how the business associate can legally use or disclose protected health information. The agreement also mandates that the business associate must take appropriate measures to protect the confidentiality, integrity, and availability of this information. In addition, the business associate must report any breaches or unauthorized disclosures of protected health information to the covered entity. If the business associate uses subcontractors who will have access to protected health information, the BAA must ensure those subcontractors agree to the same restrictions and safeguards. The agreement also outlines the business associate's responsibilities regarding access and amendment requests. They must comply with requests from the covered entity or individuals to access or amend protected health information as required by HIPAA. When the contract ends, the BAA specifies the steps to return or destroy protected health information. A BAA is necessary whenever a covered entity shares protected health information with a business associate, except for certain treatment, payment, or healthcare operations uses. This requirement was strengthened by the Health Information Technology for Economic and Clinical Health Act, which aimed to close previous gaps in enforcement where covered entities relied on verbal assurances. From an administrative career perspective, understanding and managing HIPAA Business Associate Agreements is vital for compliance officers and administrative professionals. Properly drafting, executing, and monitoring these agreements helps protect patient information and reduces legal risks. Administrative professionals may also coordinate training, documentation, and audits related to HIPAA compliance certification and licensing requirements. In essence, a HIPAA Business Associate Agreement is a key document that outlines the responsibilities of business associates in protecting patient information, supporting the overall framework of HIPAA compliance in healthcare administration.